Welcome in and thanks for joining us today. I'm your moderator, Nick Iannelli, and my guest is Dr. William Stern, Fellow of the American College of Gastroenterology. So, Doctor, we were stunned earlier this year when the very popular actor Chadwick Boseman, who was the star of the movie Black Panther, died after a battle with colon cancer. No one knew, publicly at least, that he was going through this battle. And it was a shock and it was a tragic case, not only because he was a beloved actor by so many, but also because deaths like his can be preventable if the illness is caught early enough. The American Cancer Society recommends that all adults with an average risk of colorectal cancer undergo regular screening. So, Doctor, when you hear about a story like Chadwick Boseman and the public hears about that story, what is your advice for the average person out there who might hear about the story and get a little scared by it and think that they should be screened? Should everyone be screened? And if not, when is the best time to get screened?
Great questions. He was a great actor and a great person, and it was sad to lose him. It is a wake-up call for people because colorectal cancer is the second most common cause of cancer death in the United States and the world. And it can be prevented. Colon cancer starts off as a little growth called a polyp in the colon, and it may take 7 or 10 years for that growth to grow into a cancer. So we have a nice window of opportunity where if we find the polyp, remove it, we've prevented cancer. And the American Cancer Society currently recommends that everyone without any other risk factors or alarm symptoms begin screening at age 45.
And when you say risk factors, what do you mean by that? Is it symptoms? Is it family history? What does risk factors mean?
It's a little bit of both. The main risk factor is family history, because there are genetic syndromes where people in their teens and 20s can get colon polyps and colon cancer. Unfortunately, I've had young patients in their 20s. Chad was 39 when he got diagnosed with colon cancer. So if you have a family history where you have a parent, sibling, or child with colon polyps or colon cancer, you should start screening at an earlier age. We usually recommend 10 years younger than the age of what that person had their cancer or their polyps. Alarm symptoms, however, can happen to anyone even without a family history, and those include rectal bleeding, change in bowel habits, unexplained weight loss, unexplained abdominal pain. If you experience any of those, you should speak with your doctor and see whether you should get screened for colon cancer.
And getting screened for colon cancer is something that a lot of people just don't want to do, and that has been how people have viewed this particular procedure. What are some of the main reasons that you see in your expertise as far as the reluctance of going through this procedure, even though it's such a critical and vital thing that can actually save a life? Why do you think that there is that reluctance out there?
Yes, when we first started doing these about 20, 30 years ago, there was some reluctance because of the procedure, the time. Now it takes about 15, 20 minutes. You're sedated. It's very comfortable. You walk in, walk out. So the biggest impediment now is the preparation, because the colon has to be squeaky clean in order to be able to identify small polyps and growths. And in the past, people have had to drink up to a gallon of liquid, take laxative tablets, and have running to the bathroom, cramping, etc. That has been an impediment to some of the screening.
Okay, and I know that there's a new type of preparation method that you're working with. Tell us about that method and tell us how widespread the method is. Is it something that only you and a few others are working with now, or is it something that is widespread across the medical field?
Yeah, it was a sort of an ingenious idea. It's called Hygieacare, and it's a system where you don't take much of a prep the day before, some liquids, a couple of tablets, but no gallon of solution, no cramping, no running to the bathroom. You come about an hour or so prior to your procedure. You sit on a very comfortable lounge chair. A very gentle nozzle is put into your rectum, and using gravity, your colon is washed clear. This was actually used in a lot of fancy spas in Europe to give patients comfort, but we're using it to clean the colon, and it's very well tolerated, and most patients who've done it said they'd never go back to the other prep. About 15,000 people in the US have currently been treated with this. There are only currently 4 centers that are doing it, but we're bringing it to the metropolitan Washington area towards the end of this year, in December of this year.
Okay, and when you say you're doing it, you mean Capital Digestive Care? Is that what you mean?
Capital Digestive Care, correct.
And this is just one facility that has this, or are there going to be multiple facilities?
Well, the facility is actually a separate office from where you actually get the colonoscopy. It's in Rockville. And patients in the other cities that have done this include Austin, Cincinnati, Norfolk, and in Mississippi. But patients sometimes, if their facility for getting the procedure isn't right next door, they can drive 10 or 15 minutes to whatever facility they're going to for the colonoscopy. In our situation, where we put our initial office, is located near 3 or 4 different outpatient endoscopy centers. So it will be available to lots of patients. Capital Digestive Care also has outpatient colonoscopy centers in Chevy Chase, Laurel, and DC. And people could come up to Rockville, get their prep, and go to one of those other places. It's not quite as convenient, but once we get up and running, we may put in a facility in one of those other areas also.
And how would you compare the traditional prep, which you say is unpleasant? How would you compare that with this new kind of prep as it relates to how much time a patient has to go through and how much inconvenience? Can you compare and contrast the two a little bit to give people a better idea?
Sure. So the routine prep the day before, you're taking liquids and you're starting to prep in the afternoon or evening. So you're kind of incapacitated at that time. You need to be near a bathroom. With this prep, the day before, you're on liquids, but you're not taking any laxatives. You're taking 2 tablets at night before. So there's no inconvenience really the day before. You're coming in about an hour and a half prior to your procedure, which is not very much different. Normally we have patients come in about 30 or 40 minutes prior to their procedure. And while you're sitting on this lounge chair getting prepped, you can watch TV, you can read. It's what patients tell us, a very relaxing experience. One of my colleagues, Dr. Johnson down in Norfolk, flew to Austin to get it done for himself to check it out. I'm actually I'm due for my colonoscopy within the next few months, so I'm planning to do this prep prior to my colonoscopy.
Let's talk about patient safety, especially right now with the coronavirus pandemic. We know that hospitals are not the same. Emergency rooms, everything across medicine is completely changed right now because of the pandemic. Tell us how your industry and what you do has changed during the pandemic and what can be done to better protect patients, especially during the screening process that we're talking about.
Excellent questions. Between March, when the pandemic really hit, and probably around June, we were only doing emergency procedures. And we had advised anyone for just routine colorectal cancer screening, mammography, et cetera, to hold off. Starting in June, we've started doing the procedures again. And the American Cancer Society was concerned that people would start getting more cancers if they weren't getting screened. What we did very uniquely, I'm not sure many other gastroenterology practices are doing this, is we're checking all our patients 2 to 3 days prior to their procedure for COVID. And we have our own COVID test in our own lab. So if you're scheduled for your procedure on a Wednesday, you'll get a COVID test on Monday. It's done from the front of your nose. It's very comfortable. You actually do it yourself. And we get the turnarounds overnight. So we get the result on Tuesday morning. We tell you, yes, you can go ahead with your prep. We certainly don't want people prepping and not showing up for their colonoscopy because they have symptoms. So that ensures the safety both for the patient and the staff. And on the other side, the doctors and the staff, at least in our practice, are getting COVID tested every other week. So we want to reassure patients that we're taking extra caution. In our outpatient facilities, we're not treating any COVID patients or any sick patients. And we're doing extra cleaning between patients. So between June and now, we've probably done 10,000 patients, and everyone's been safe, both on the provider side and on the patient side.
Okay, I'd like to thank today's guest, Dr. William Stern, Fellow of the American College of Gastroenterology. I'm your moderator, Nick Iannelli. For more on this discussion, visit WTOP.com and search Capital Digestive Care.